going to do vaginal prep. The first thing that we want to do is to make sure that we've checked our patient's allergies. And in this case, we're going to say that our patient does not have any. We're going to check our kit for sterility for all the things that we've talked about in the past, making sure there's no holes or tears, or it's not moist or wet or dirt, and we're going to check the expiration date. I'm going to check my prep table where I want to place my prep kit to make sure it's clean and dry. And then I like to put my kit on the table at an angle so that when I open it up, the entire table is covered. So I'm going to open it like we would as an unsterile person. And every hospital may have kits that look a little bit different. This kit now has come with a set of sterile gloves followed by a sterile towel and some sponges that are on sticks and then sponges that are not on sticks. You need to follow the physician's preference card. It's probably most common to find that your surgeon will want you to use betadine solution for this type of prep. And so the first thing that I'm going to do is I'm going to put a chucks or tripod down underneath the patient to catch any drips. And our patient will most likely be asleep for this procedure. I'm going to pick up my towel and my gloves. And I'm really not going to need to use that towel for this type of procedure. I'm going to set my gloves off to the side, and now I'm going to pour my betadine solution. You want to make sure that you pour with the lip of the bottle over the sponges. And you can always turn the table with your foot if you need to. In this case, you are going to need to use the sponges that are on the sponge sticks. If your kit did not come with sponges on the sponge sticks, an option would be to use a sponge on a sponge ring forceps, and that would work too.
Are those both solution? Or
that is betadine solution.
Okay. Oh, you just paint. Okay.
I'm going to put my sterile gloves on using the open glove technique.
Can you explain why it's just the solution, Candy?
That's physician preference, and that just is pretty much what we use here in Duluth, Minnesota. Real common to use betadine solution. If your patient was allergic to iodine or seafood, oh, now you just went in front.
Huh?
Of her filming.
Oh, I wanted to give her like a tripod.
I got to start over.
What? Do it? No, you don't.
No, just keep
Are you going to just edit it?
Yeah.
Yeah, it'll be fine.
Are you sure?
Yeah, this is very
She doesn't know how to edit it.
Just keep going.
Yeah,
all right.
Jeremy can edit it.
It's informal, very informal.
All right. Okay. So betadine is the most common thing that's used. You know, it's kind of, there's a lot of controversy out there, like I said, that if the patient is allergic to seafood or fish that you couldn't use iodine. I'm not so sure that's true. It is probably a practice that we still follow, even though that isn't true. Now, if your bed is not in the right height for you to do this, ask anesthesia to raise the bed, or go raise the bed yourself before you start the prep. And actually, Sylvie, if you wouldn't mind raising it a little bit, because it is a little low for me. So I'm going to start out, and this hand you need to keep kind of dead. You need to keep it sterile. Don't touch yourself or anything. Just keep it out here, because you are going to need to use this hand when you prep the vaginal area to the cervix with sponges. So I'm going to start out at the pubis and the perineal area, and I just go up and down and clean the labial area there. And then the last thing that I do is I wipe the anus. Now, you're going to wipe down. You're not going to go up. You're going to go down, and you're not going to touch the bed, because if you do, you will have contaminated your gloves. And then you want to have a kick bucket nearby or some receptacle. You can surely put them right there, too. You have in your kit 6 sponges, so I tend to use 4 on the perineal area, and then I use 2 on the legs, and I will clean the anus. Every sponge you're going to use to clean the anus. I'm going to do the legs next. I don't know that there's any particular sequence that you need to do. And you can do each leg with the sponge and wipe the anus again. Now, in a real person, you know that her buttocks are going to be right on the edge, and you want to really be careful that you don't contaminate that sponge. So I've used 3, and I'm going to do the legs again. And you have to get a fair distance up the legs. The drape is going to come down like this. And I have 2 left, so I like to do the perineal area last. And then my last sponge. Okay, now I'm going to take the sticks, and again it's just betadine solution, and I'm going to use my left hand then. If you're right-handed, I suppose you'd switch hands. I turn my hand around and I spread the labia, and I'm going to go in till I meet some resistance. Don't push any further, and then you're going to just do a circular motion, come out and clean the anus, and you're going to do that with all 3 sponges. So you're going to keep your hand here. You're not going to keep taking it out. You keep your hand here, so your kit has to be close by, and clean the anus left. And that's it.